analytics firm Weber Phillips and an expert on race and equality. He's been asked to be an advisor on the government review of the impact of the virus on BAME communities. Thank you very much for joining us today, Trevor. So what is the data saying to you at the moment? Clearly, a lot of investigation and a lot of work needs to be done on the details of the data, but are you getting a sense that black and minority ethnic communities are being disproportionately affected by COVID-19?
Well, thank you for having me on, Anita. Yes, and there are several different sources. My firm actually was first alerted to this because we have clients who are local authorities, police, and also health authorities who were worried about two things. One is that they thought that some of the public health messages were not getting through to some communities, but latterly what they've also been seeing is some suggestion that some communities are more affected than others. I think people that we work with are also worried that, to be absolutely frank, the kind of slight madness that we've been hearing from the White House was reflected in conspiracy theories, for example, that black people were basically immune to this. There is some suggestion that one of the reasons that there'd been a real extraordinary level of excess deaths amongst African Americans is because this idea had got around that they were immune and they were slow to respond to it. So we did some early work about a couple of weeks ago, which showed that local authorities which had particular ethnic minority groups were much more affected, but also, by the way, that some local authorities which had a concentration of some ethnic minority groups were less. So, for example, those that had large Pakistani, Muslim or Bangladeshi groups were less affected, whereas those that had larger Indian groups were more affected. And that's supported by research which is published in the Times today.
Yes, on Muslim communities, you've been talking about, whether in the Muslim faith, the washing of hands as part of the faith multiple times a day might be contributing to lower rates of coronavirus.
Well, that was the first question, because the thing that people have been saying, which is that this is really correlated to poverty and overcrowding, really is not borne out by the data. If you look at local authority statistics, and we are now probably going to look in even more detail at individual postcodes, we think that that actually is not borne out by the data. What we think is much more likely that this reflects is that there are differences in age profiles. So, for example, NHS England's data about mortality, about 12,000 plus deaths, when you analyse them, what you can see is that there is a very dramatic difference between ethnic groups. The average for the whole country is something like 22, 23 per 100,000 deaths. For African Caribbeans, it's 69. Now, what is odd, if you think this is about just some sort of race thing, is that the rate for deaths amongst Africans is about 27. There's a difference of between 27 for Africans and for people like me from the Caribbean. And that is not explained by genetics. So we need to look much more closely at this.
It's going to be a very nuanced investigation. You're talking about potentially the impact of the age demographics, potentially cultural or faith impacts. We were looking at this issue a couple of weeks ago, and I talked to a doctor in the Midlands, and he had started, based on anecdotal evidence of people from South Asian communities of South Asian origin being more affected in his area. And then alongside him, a UN worker who was talking about the example in the States of Chicago, 70% of African Americans there dying from a coronavirus, even though they made up 30% of the population in the city. And she was talking about certain groups being more heavily employed, more heavily exposed to coronavirus because of the nature of their work. Is that something also that you'll be looking at here?
Well, I was going to say that we think one of the variants that we need to look very variables we need to look at is age, but the other, which we think is very, very important, is probably going to be occupation. And one of the possible explanations is that some groups are preferentially employed in areas where they are much more frequently in contact with large numbers of the public. So, for example, people who work on the frontline operational end of transport. But having said that, there's been a lot of talk about the excess or the disproportionality within the National Health Service. A new piece of research which came out of Newcastle, published the day before yesterday, suggests that there is actually no particular difference between health service workers who are in contact with patients and health service workers who are not. And though that there is an ethnic disproportionality, it suggests that it's much more likely to be being acquired in the community than in their health service occupations.
It sounds like it might take quite a long time, Trevor, to get to the bottom of all of this. I mean, when do you hope to report? Can you say that yet?
Well, what we're only one actor here. We're providing some technology and some experience. This is going to be led by Public Health England. I think that they will probably publish some data within the next couple of weeks. But I think actually it may not take as long as we think, as long as we're able to get the right data. And if I may just say, I think one of the issues that this whole episode illustrates is that our data collection and our data protection regime is so way out of date. Most organizations have been discouraged by the data protection regulators from collecting and keeping data about ethnicity. So actually, if we had been keeping regular data, we would have known all about this a month ago. We are at least a month behind where we need to be, simply because people have been too squeamish to collect data about ethnicity. And this should be a lesson for us for the future.
OK, Trevor Phillips, thank you very much for your time today.
We will make America great again.